Greetings. There's a medical word called Inta, though it's an Igbo word, Inta, NTA, Inta, something like that, or Unta, something like that. Unta, that is NTA. Sometimes the Igbo pronounce N as U, right? It affects baby. It affects the baby. And though some literature said that it is common in the eastern part of Nigeria, but I know I've seen such conditions in other parts of the country. And these children were not Igbos from Igbo parents, right? But it's just that it's like it was first seen there. They call it Inta. It just, what happens in Inta is that the baby just fails to thrive. They call it failure to thrive. The baby just fails to thrive. No matter the baby will look like the a child that is not eating. It will look like a child that has what they call protein energy malnutrition, marasmus and kwashiorkor or something like that. The child will have rash all over the body. The child will be lean. The child will look old. The skin will be flabby, right? The skin will be flabby. The skin of the child will be flabby. There will be rash all over. The child is fussy. The child is always crying. The mother is confused. And sometimes it can cause depression for the mother. And sometimes the children die from the disease, right? I said, let me talk about it today because I think somebody actually messaged me that her child had Inta, though from the person is from the eastern part. I've written about it before. I will also post what I wrote. I wrote about it as far back as 2021, right? This Inta, what really causes it? The child is not just growing. 1 year old child will just look like, or even 2 years old child will look as if nothing is just happening. If you look at the child, you will even be blaming the parents that you are not feeding this child well, right? The child will be having diarrhea. Anything you give the child, it's not the one you people complain that you feed your baby, the baby will stool. That's not what we are talking about. I'll put a picture. I'll put a picture. I'll try as much as possible to put a picture so that you see what I'm talking about. Rash all over the body. The child look old, wizened, angry, sad. Like the child just look not happy. And the child is not just growing, right? You'll be the bone all over the child's body and the rest. They call it intact, right? I saw it again, though it's no longer something that is very common, no. But I think I saw it again, and it's even in literature, right? Now, what causes this intact? Nobody know what causes it, so really. But there are certain suggestions, theories about what, because some people have done research about it, about what causes. So some people believe it's just the normal kwashiorkor and marasmus, right? Some people believe that is what it is. While some people believe that it is more than that, right? It is more than that. It affects children between the age of let's say 6 months to let's say 18 months or to 2 years mostly. You see the children between 6 months to 2 years, child just look tired. Now, one, it is believed that is because the child is not feeding well. Because it has been found in this condition has been found in very among children born to very poor parents, the poorest of the poor, right? So because of that theory, because of that the class of people that is found with such babies, right? It is believed that it is because probably the child is not just feeding well. Sometimes you think your child is feeding, your child is not actually not feeding well. You'll be missing all the missables. Some of you will miss this and miss that. Recently, I said, don't miss this food with this food. Some people thought I'm joking. I'm serious. Don't miss this food. Don't mix pap with breast milk. Don't mix infant formula with. Feed your baby. Enrich your food. Add crayfish to your baby's food. Some people thought I was joking. I'm serious. So what I'm trying to say is that it is actually believed that it is because of the poor feeding of the child. In fact, a large school of thought, a majority of the school of thought believe that it is poor feeding from the parents. That is what is causing it. Entire. Then some people feel that the child has some gastrointestinal problem because these children are always having diarrhea, running stomach, dysentery, right? They have some form of there's what they call malabsorption problem. The child will eat, but the intestine will not be able to absorb the nutrient the child ate. So the child will just pass out whatever he or she eats, right? Is more or less like a disease of poverty. Sha. Then there are also other schools of thought that they said the child is probably has some genetic conditions. That is what is causing it. There are some that there should be more tests done on that child to find out whether the child has some issues with the genes, some birth defects that is making the child not feed well, right? If you see the child looks wasted. It looks like a child that is chronically ill, right? If you have such condition, there's nothing you can do about it at home. Oh. I think when I was when I was doing my housemanship, right, we had a child like that in pediatrics, but there's something we did. The child was admitted, and we passed an NG tube through the nose, and we're using feeding the child through that NG tube. That pass a pipe through the nose to the stomach. Blended the food, pap with crayfish pap with there's something they call Tom Brown because pediatrician is a gastrointestinal specialist in children's issues. So I was in that unit. That before 1 month, the child was on admission for 3 weeks. Before you know it, the child started gaining weight. All those skin infection, because they always have this very terrible skin infection, started clearing. When I say failure to thrive, what I mean is that the child is simply not gaining weight. Not gaining weight. No matter what you do, the child is not gaining weight. So that now convinced me that truly this child was not properly fed while at home. Right? This child was properly not fed while at home. I don't know what is causing it. I don't know what's causing it. I think something need to be done because it's commoner in the east. That's why it may be also be common in the southwest, north, and the rest too. But there may be something also in the environment that is causing it. That is how scientists think. What could be causing this thing? Is it the environment? Is it the parents that don't have enough money to feed the child? Is it that is it from ignorance? What could be the problem with this child? But the truth is that the child got better. Then the child, it may also be some vitamin deficiency. Some people believe it's vitamin deficiency. If the child is lacking essential vitamins like vitamin C, vitamin A, vitamin E, vitamin zinc, calcium, all those things. Because that can be explained with the poor skin. If you see the skin of the child, it's not looking healthy, right? I decided to talk about this Inta today because it's something I've been prompted. It's when I now got somebody said I should talk about it. I said, okay, yes, it's actually true. I should talk about it. I'll talk about, as I've spoken about it now, I will also share the link where you can read more about it. I wrote something about it before. I'll share the link so that way you can read more about it and understand it better. Inta is real, oh. Inta is real. It's real. Maybe I'll ask my colleagues in pediatrics whether they've seen any case like that again. Because that this one I'm saying, the last one I saw was in 2017, 2018, long ago. I've not seen any, but I'm not in pediatrics, so there may have been other situations like that. You get, please, let's take note of this thing I said. If you know you have a child with inter, right, with that condition, this failure to thrive, go to the hospital. All this herbal medicine will not help you. It's not what you can treat with it because the child is prone to conditions, seizures, heart failure, skin diseases, right? Diarrhea, chronic diarrhea, and so many other issues. The child is not growing, not gaining weight, losing nutrients, and the rest. You get. And also, it's also found in mothers that they did not even wait for their child to get to 1 year before they got pregnant again. You know, once a mother gets pregnant before the child is of age, like 2 years or the rest, they will abandon that child and start taking care of the one in the tummy. It has also been seen in such mothers, in such families. It's also why you see the WHO will tell you to space your children very well. Because once you get pregnant before your child becomes 2 years, 1 year, or even 1 year, 18 months, you have taken that childhood, you have stolen the child's childhood. You are punishing that child. Look at some of the children that were given birth to, and before you know it, their mother got pregnant again. I got pregnant 3 months after delivery. The child suffers. So all these things can cause entire social issues too. Not spacing children very well, poverty and the rest. Let's look at these things. It's when I even check literature, I saw it in literature. I was very happy, and I was happy that it was a Nigerian that actually wrote it based on his experience, or a group of doctors from Nigeria that wrote based on their experience. It's good. It's contribution to knowledge. Please watch this video and share. Please share this video so that people can be more knowledgeable about this issue. It's like a neglected disease, a neglected problem. People don't talk about it, but it's there. Thank you and bye bye.